My name is Justin Slacky. I'm the Vice President of the State Health. I want to first of all welcome all of you to this Healthcare Best Practice Conference. It's great to see such a great turnout. And first of all, can everybody hear me okay? I don't have a lot of experience with these things outside of weddings and a really awkward bar mitzvah. That would be funny if they brought the lone Catholic guy up to give a speech. So if you can't hear me, just raise your hand, yell out. I'm pretty informal, so I'm not going to get offended easily. But I want to thank not only some of our own clients that have come here and are not only attending, but also speaking and talking about their healthcare journeys and what they've done to battle the outrageous industry of healthcare that we have in our country right now. But I also want to thank other employers who have made the trip out here, some near, some far, and also our healthcare colleagues in the industry who are also working to change healthcare in this country. So thank you all again for coming. It's really great to see this kind of a turnout. So when I was thinking about how to introduce today, one thing kept popping into my head, and for better or for worse, I don't want to start a bloodbath out there, but you hear politicians talking about, is healthcare a right? And politicians are really good at arguing with one another about stuff and not really giving much ground, especially nowadays. They don't really reach across the aisle. And I kept thinking to myself, well, what if they just didn't use that word right? What if they instead talked about, is healthcare necessary? Because I think we can all agree that healthcare is necessary. And it's not just necessary for our physical well-being and the physical well-being of our families, but from a corporate perspective, it's essential to employers and those who work with employers. And it's not just for their employees' families' health and their health, it's for the corporate health. If you don't offer healthcare benefits to your staff, your employees, and get healthcare benefits, you're gonna have a hard time retaining those employees, hiring good employees, and being able to do the work that you want to do for your clients. And so when we look at the healthcare landscape that we have in our country today, there are what I consider three necessary evils that stand in the way of being able to offer great healthcare benefits as an employer. And those are, you have the health insurers, you have the healthcare systems, and you have my personal favorite, the pharmacy benefit managers, or PBMs. And what I think you'll find today, and that I hope that you all take away from here, is some nuggets of knowledge and some insights that you didn't have before you came here about how you can navigate around those three necessary evils. And I use necessary evils specifically, that term, because they are necessary to a certain extent. In principle, you need health insurance. You need to be able to, that catastrophic car accident, that broken leg, that trip to the emergency room, you need health insurance for that, just like you need life insurance, just like you need home insurance, renter's insurance, whatever it might be. You need hospital systems too. We run, a DPC practice. We provide primary care, urgent care. We go above and beyond, do a lot of extra stuff, but we are in an emergency room. We can't take care of everything. So you do need hospital systems as well. And you need pharmacy benefit managers as well. You need somebody to negotiate on behalf of with the pharmaceutical companies and the manufacturers to keep drugs and necessary life-saving pharmaceuticals at a reasonable price. However, those three entities have pretty much perverted the system, and they're taking advantage of a rigged system. Right? And so I challenge all of you, and I want you to kind of change the thinking that you think about those three entities from being kind of partners or things that you partner with to provide benefits to your employees. Think of them more as competitors, because they're not just taking money from you in droves. They're also taking money from your clients and your customers as well, because I'll ask for a show of hands. Who here would say that their healthcare costs are probably in the top 2-3 expenditures year to year for their company? I know it's for ours. And when you think about your clients and your customers, they're dealing with the same thing. So every dollar that those healthcare systems, those PBMs, those health insurers take from your clients and your customers, that's one less purchase order, that's one less service contracted for. So I want you to think about them as competitors too. And I think you'll find from kind of diverse panel of speakers that we have today that you will see that you can gain a competitive edge on. That there is ways around it. There is ways, maybe not necessarily defeat them, but there is ways to compete with them. And you're going to hear stories from local employers, ranging in various sizes, talking about their healthcare experiences, their healthcare journey, their stories. You're also going to hear from those who are in the healthcare industry that are working to change things from the inside out, and are doing things completely different than what is traditional. And so that's really what I want to challenge all of you to do, is just really think outside the box, think creatively about how we can challenge these three traditional bulwarks in the healthcare industry, because it can be done. And a lot of the folks you're going to hear from today are doing that. And so I ask you to give them your support, give them your listening ear, and really take away something from this conference that you can put into action, maybe not right away, but soon, because I guarantee you it can be done. So I will get up.